Bellow forth. I just want to tell everyone we're live. You get a picture of this. Very exciting this evening.
We got a new cat.
Oh, yeah?
A new Sphinx cat. And the
wow.
cat, very, very powerful psychically. And the cat wanted to be involved, so Rita had to take the cat downstairs.
Hello, Jane.
Hi, Rita. How are you?
Oh, I'm great. I just took our kitty down because she was trying to do biofeedback with her claws.
Are you feeling better?
Yeah, I'm coming together. Still a little bit weak because I had some fever for a week, but I'm going to be all right.
What do you think happened?
I had to go to Romania to do some business, and they have a big, gigantic new influenza virus because we did a COVID test and I don't have COVID, but I have collected probably some virus out there. Romania is right now in the red zone. Red zone. They are one of the most infected countries, so they have some problems there.
Yeah, they might be closing next week.
Yeah.
Did you do the PCR test?
I did the PCR and I did also the saliva test.
So, you know, I'm finding exactly the same pattern, the same blood under the microscope with all the particles and, you know, scattered parasites and clotting as you would find in an injected person. So I posted on the group, there was a lady who had done 4 drive-in PCR tests. And she came to see me, and as I said to you, no injection, and her blood was the same as I'm seeing in the injected people. So there's something going on, and I mean, alive, you know, the microscope doesn't lie. So
you're talking about the vaccinated people.
Pardon?
You talk about vaccinated people, or
no. She had 4 drive-through PCR tests, and her blood was the same as a vaccinated person. I saw the same particles, the same toxins, the same clotting, the same rouleau, the same fibrin networks.
She did not get vaccinated.
No.
Oh, interesting.
Very interesting. There's a lot of interesting things coming out right now. So stay tuned is all I can say. It's not. Let's see if everybody. We got a nice group of people here this evening. And it's on 7. I'm going to formally introduce you, Desi and Rita. Welcome everybody to the new IMUNE 365 Healthy by Choice lecture series. They're complimentary and we have loads of them on the Jane McKenzie YouTube, fortunately saved, and lots and lots and lots of training on all aspects. Whatever Desi, Rita and myself have gone through over the last year and a half are virtually all posted there. So just so you know, we've harnessed all of that information. And we are introducing those of you who know and those of you who are new to the new quantum evidence-based medicine. We have Professor Desire Dubounet with us. She is a world leader and pioneer in this area, and she's brought to us the most unbelievable OMNIS software, which we're going to be speaking about tonight. She speaks so much about raising life force to achieve maximized health and wellness. We look at this for people who are looking to maintain their health and also go to the next level, and also for people who have chronic disease and are looking to ward off disease and rebalance themselves and regain their health. How we do this specifically is looking at root causes of disease and then validating and verifying the risk factors. this evening we have Desire Dubounet linked up to the OMNIS software. And we really, really welcome you warmly, Desi and Rita, to our program this evening, and look forward to receiving such invaluable information for not only therapists, but for people listening in who really, really want to learn about quantum. So thank you for your time and effort. I know your schedule is really busy. We really do appreciate it. And over to you, Professor Desire Dubounet.
Okay, we're going to see if we can get this screen share up here now.
So Desi is connected to the OMNIS quantum software, and she's wanting to share a screen with us.
Okay. I don't see the right window here. So bear with me a little bit. Yeah, I'm trying to share something that
All right.
it won't let me share though. Let me see. Okay. Let's try this.
The software, quantum software that Professor Desire Dubounet has brought to the world for that matter, is really, really leading edge. And there's nothing else on the planet that is anywhere close to what she's managed to do and bring in terms of the new paradigm, the quantum medicine space.
Can you see my screen?
Yeah, we can see it. You just need to click on the program you wish to have. So click on the bottom. Is it in a Word, or is it in? Just click on the bottom of your screen where you want it to be.
We're trying to get the QX software to come up. It's right there.
Is it not stored at the bottom of your?
No, I can have you give me the mouse on it.
Oh, yeah, there's a,
Yeah, give me the mouse.
Yeah. See, we've never done the screensaver here. Okay, I'll try putting the icon on the bottom.
Yeah, try that.
And
Yes, now choose which one you want. Choose which one. Yeah, that's it. Perfect. Just give it a second.
Oh, here we go.
Here we go. Mm-hmm.
Okay. Now, Rita.
Shot.
Okay. So we are going to postpone the update for now, and I am going to log in. And Desiree will be the patient for tonight. Hello, everybody. We are going to introduce you the program and the new software. Now we are connecting to the device.
Hopefully.
Hopefully, the Omni usually takes very short time, so.
We never tried it with Zoom.
There we go.
Yeah,
Rita,
and then, yes,
Rita, click on the little box at the top right to enlarge your screen.
1 moment, please.
When you're ready, yeah.
Yeah, when I'm ready, I will. Just let me get to the.
It's kind of eerie that
Yeah.
going on to infinity there.
Yeah. You have to give us a couple of seconds here.
But you're watching her moving the mouse, clicking on the buttons.
Yeah, maybe I have to do a little update because I don't know if it will start or not.
We'll find out. The only way we can tell if this works with Zoom is to try it with Zoom. Or don't do the update now.
Oh,
But it's working, so you have no problem.
It's working, praise the Lord. So Desiree will be my patient today.
Tough patient.
She's already hooked up with the harnesses and she's fully relaxed.
And Rita, 2 weeks ago we did the SOC, so we have trained on that part already.
We'll go through it briefly.
Yeah, we just go through it briefly, and we are going to show the calibration. Okay, we are in demographics, and we'll choose the patient. Takes a couple of seconds until the language update progress finishes here. But it will. Okay, so we are going to load the previous patient.
Now we'll go to the previous patient because I'm already in the computer.
Yes. Great.
You click on my name.
I know.
And go to previous patient. Now we take a look at we ask the, go back. We ask the patient, is there any change in the SOC? Is there any change from the last time? I'm under lots of stress.
Yeah, what is your stress level today?
Well, the old has down there fevers. Well, my stress today is at 10.
Can you give me the keyboard?
Yes, I can.
Yeah, so we actually that can change every day how the patient currently feels, or the stress levels change, the happiness level. So it is worthwhile to ask, how do you feel today if you do another session?
She did a quick test on me before I put everything in.
Okay, would you like to add
exercise sessions? I do.
Okay.
Exercise sessions. Sugar 2 a day.
You shouldn't, but you do, I know.
I have a little bit of sugar. I have a
cup of coffee or tea, you have 2 or 3.
2 cups of coffee in the morning. Actually, I switched to Ganoderma.
Ganoderma coffee.
And it's really great. See, no organs removed. Rate my happiness. Let's go back to the beginning. Rate my happiness. I'm going to give me a 10 there. I'm really happy. A lot of stress, but I'm still happy.
Am I adding to your happiness a little bit?
Most of the time. Oh. 99% of the time.
Oh, great. Good to hear.
And
how much are you? How much
allergies? I'm dealing with a cat allergy. We got a new cat allergy.
And we love the cat.
But I have an allergy to cats. Let's see if
tell Jane that the cat is like the crystal device.
Yeah, it's a Sphinx cat. It's very interesting.
Do you have any unresolved mental factors? How much is the whole plant foods in your diet? The amount?
80%.
Okay, then what should I say? 9, 8?
You just put an 8, that means 8.
Do you have any overweight?
Am I overweight? I believe that I'm still 7 kilos over. We won't put this in. We'll do another course on how to work with that.
Yeah.
Okay, now you're going to have to go to the patient data. And you have to modify. Yeah, modify patient.
Yeah.
Modify.
And now save.
Now you save. Now what we just did is we saved the new SOC data. That changes.
That can change any day.
Now, I used to be go back. I used to be a top class athlete, but I'm not now. And today we're trying to find out about my cat allergy, and we're also dealing with my back pain.
And if you switch the program to the top class athlete button, then it changes the whole sport program, and then it modifies a couple
Everything is looking for peak performance if you click that button. If you don't click that button, it's looking for disease states. Okay?
Yeah.
Now you can close. Go to calibration. Fast track calibration does it all. I'm going to be trying to do breathing exercises. And we want to start teaching our people to do belly breathing while we're doing
on a daily basis.
Well, especially while we're doing the calibration of the test. You want to teach them to do belly breathing.
Would you like to share anything about the sphinx cat and the energy?
No, we're showing people that.
Are you working on any new videos? What are going to be available?
Let's just focus on the little. You see that some of those things are changing. To that changing automatically to my body unconscious. Do the EEG. Let's see how the EEG works.
Rita,
Yes.
the sound is really faint. Can you turn up the volume on your side?
Okay.
Well, we're on max.
Yeah, we are on max.
You're on max. Okay, I think it's because the computer is. Yeah. Okay, fine. They can hear, but not properly. I must say, I'm also battling to hear a bit.
Okay, this needs usually a couple of screens to adjust.
Not adjusting. It's
Can you speak up?
no, it's not. I think this is the old software. We haven't updated it.
Yeah, we did not.
So let's try the ECG. They fixed the ECG, EEG, and I don't think that we got the new one. Oh, there's the heartbeat. Good heartbeat. Pulses at 60. And you can see at the top there's some potassium deficiency, magnesium deficiency, little sinus rhythm problem, slight conduction disorder. No big deal. And I'm in a state of frustration. That's very true. You see at the top underneath of the upper left? Fear. Picking up some emotions.
What are you afraid of?
Afraid of immigration. Crazy. Okay, we got an idea. Now we can stop. We can close. We'll teach you some of the other functions.
With the updated
We'll teach you the lie detector some other time when I'm not hooked up.
Are you ready for the test?
Rita, is there any chance of getting the computer a little bit closer to Desi?
No.
Because we.
No, because she is harnessed up. She will not be able to. Usually, I do the system power settings here. We can
don't touch that. Don't touch one of them.
I'm just asking just so that we can get a better sound.
The video is unavailable. I replaced the video today, but it's in the new software. Not today's software. So you'll see the video that will be, but it's not on today's software. Everybody who gets the software after tomorrow will get the video. You can see my SOC index is 53. Voltage is good. My amperage is weak. Amperage reflects. Resistance 92, normal. Hydration, I'm thirsty. I am feeling thirsty. I should get some water.
After the test. You said that before the test, I mean during the test.
You shouldn't really change things dramatically during the test. So you shouldn't take water during the test, before the test. And I shouldn't be talking so much, but I'm trying to help people understand. Oxygen transfer disease, well, I have an allergy, so I'm not getting proper oxygen. Move the QX down so it becomes the panel. Move that down. That's enough. Proton pressure, I'm a little bit on the alkaline side. No, it may slightly acid. And my number one thing is calcium ascorbate, which I took a couple of minutes ago. Before the test, I took some of that. Muscle torso triangle. Is it open?
We are going to turn on the second waveform generator.
I'm
trying. Come off now. Okay, here's the second waveform generator. I will do it one more time. Now, there it goes. Yeah, now I treated the highest value in the matrix of you.
Rita, we can't hear very well. Hey?
Okay,
you can't turn on the second waveform generator until after the test.
Okay.
And Rita wanted to turn on this generator, so she went into a procedure. She didn't tell the audience.
Okay, what I did, I picked up, I chose the highest, I pick up.
Yeah.
What Desiree's test screen actually picked, and I put it here into hold on the other side on the right, and I clicked on treat.
Okay, Rita, let's go back to the calcium ascorbate. You see it?
Yeah.
Now, you see the black arrow pointing to it?
No, it's a blue arrow.
The black arrow. Blue arrow. Okay, blue arrow. That means that is loaded. You don't have to. So if you hit treat, it picks whatever that arrow is on. And it also will pick what's inside the hold tray. So you didn't have to drag drop it to the hold tray. But when she treated it again, that gave her the chance to turn on the second waveform generator. So you see how that worked? Now we're treating the calcium ascorbate again, and it's rectified. 92 the last time. 92. No, there we go. 92, so that's good. Okay, now
we can go to this profile.
We take a look at the front page. Don't do anything yet. Don't do it yet. Just take a look at the front page. And allergy, there it is, right there. 136 allergy. That's distinctly relative to my problem. And the muscle torso angle, that's down at the low back. That's exactly where my problem is in the back. So the machine's picking these things up, and it's worthwhile to treat them now. But since the arrow's on it, all you have to do is click treat now. You don't have to drag it. And I feel a little better. I can breathe better. And the pain in my back has improved a little bit. Okay, so let's now see bronchial aid. Go up there a little higher there, see it? Bronchial aid. And see renal detox. I suspect that some of my back problem is connected to kidney. And the machine's starting to pick this up as well. Okay? We don't have to treat all these things. Now we can go to risk profile and look at the overall trends. Number one, hypoadrenia, stress, circulation, food poisoning. Everybody gets food poisoning. Sugar regulation, immune system. Okay, so we can see. We always want to treat the top choice. Clear it out. But that's my unconscious choice.
I will show the superconscious patient panel where we can actually type in a given problem or a issue what needs to be solved, and then we can connect all the programs and all the panels to that issue, and we can just go through the risk profile, the spinal screen, homotoxicology, nutrition. After the risk profile, I will show you how to get to that panel and make it a lot quicker and easier to treat something what you really want to treat.
It says immune system.
Yeah.
I thought you did hypoadrenia.
I added on the first 5 issues.
No, you don't need to do that. Just do one. Let's go back. Go back to this profile. Don't do the top 5. Just do the top 1.
Okay, then I take it out. I have seen many people.
I know a lot of people teach you the wrong way to do this. Hypoadrenia. And you don't have to even do that because it's already on the button. Treat the unconscious choice as a sacred thing in and of itself, because that's what my unconscious chose. So let's give my unconscious some service and a little bit of respect and treat just what the unconscious does. It says, I am free from excess lust. That's the affirmation that my unconscious is fixed.
I think that you're satisfying that pretty well.
Obviously, it's a little bit of a problem that came up from it.
You are on the extreme side.
Okay. Primary causes. Now, let's just take a look at it. Primary cause of my problems, lack of awareness. There's something going on that I'm not quite aware. Dealing with mental problems. I have this cat allergy, and I was never allergic to cats until a very precious cat of mine named Snow. And, oh, geez, it was 50 years ago. And I saw my precious cat get run over by a truck. And I just didn't get over it. And I think I developed a cat allergy because of that. So I think that there is mental factors and possibly fear attached to that.
Okay, I have a similar story. The last time I had a cat, I was 8 years old, and I had to watch my favorite beloved cat ripped apart by my bull mastiff dog.
Your own dog.
Yeah, so it was a big shock, and now we are both trying to recover our fears and allergies, because I also developed kind of an overall animal hair allergy also to dogs. But this kitty is bringing a lot of joy and magic into our life, so we are trying.
So aging suppression, something about aging. Acupunctures come up, so we'll do the acupuncture. We have mental factors, imponderables. I need exercise, yoga. A lot of little things I've reacted to. Nothing so pending. Now we go to homotoxicology. What did you do?
I just clicked on your heart. That's very important. If heart comes up, what is actually the motor of the whole human body, we should give it at least 1 treat shot. Yeah, heart is very important, and also the brain. I think if that comes up as most stressed organ, we should give it a click.
In homotoxicology. I go to homotoxicology because as a trained medical doctor, this works for me. Some people might not understand these things. Now, up in the top, we can see that I picked reaction phase and degeneration, fibrous, and accumulation of tissues. I'm going to go to that degeneration fibrous. That's in red for a reason. Now, I look at the other red ones here: skin, nerves, organs, lungs, bone marrow, stem cells,
heart muscle.
And I think probably the best place for me to start today,
adrenal,
not having this back pain.
Bone marrow then, or
so I think the bone marrow.
Bone marrow, okay. Anything what you want to add? Back pain or
back pain. If I want to add something else, I have to use 2 spaces or a comma. Now we click on that. And you want to treat the top 5 this year. That takes a while, so. But can you move it so we can read what's going on underneath? That's too far. Okay. Disturbances of intercellular calcium. They tell me I'm developing osteoporosis, so I'm not getting proper calcium. I would think that wouldn't be a problem, but it was, which just showed up on my recent test. Blockage of the acupuncture. So we got a second agreement, so now we need to do the acupuncture. Thymus cell toxicity. Immunosuppression from excess sunlight. Yeah, I'm getting too much sunlight, maybe.
Yeah, it's actually you lay in the sun for an hour.
Yeah, I've been getting an hour of sunshine almost every day for the summer. Worked on the tan too much, maybe. Yeah? Infections detected.
Yes, sunshine boil away you of the sun too much.
A lot of sensitivities. Okay, closed. We'll put that closed. Now the disturbance of calcium. See the calcium down. Calcium homeostasis. Up, like that. And we want to try to make sure that this is rectified 95 or more, 95% or more. So it says failure of the ATP dependent pump, so that calcium is too much calcium going into the cell. 96. Okay, that's pretty good first time. Now let's go to the next one. Blockage of enzyme poisons. Yeah, second one. To the right. Enzyme poisons. We'll click on that. The things that are showed are the things that my body has picked, and the things that the therapist is clicking on are the things that make sense to the therapist. rectified 100. Well, rectifying pretty good. Now the
calcium.
yeah, arteriosclerosis. Well, okay. But that's calcium in the bloodstream, and it's not such a big deal for me.
Pulmonary and intestinal tuberculosis, bacterial inflammation, emotionally overcritical fear of change. Maybe we should also give a shot to that.
Okay, the fear of change. Would you think unmanaged joy or fear of change?
I would pick
Oh, close.
stubborn and critical. I would pick that.
What did you pick before? The calcium. Go click on the calcium again. You got 66 last time. That's low.
Okay, I would pick stubborn and critical because that's you.
Stubborn and critical.
Yeah. You are very critical, and
After we do a couple of biological concerns here, then I always like to do at least one or two mental concerns. Do that a separate update. Just real quick. 73, not good enough. Click calcium again. Calcium up, 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 up. No, right to right to right. Up, up, calcium. There you go. Yeah, some problem in the calcium in my body.
we can also
Possibly
activate
a
the body
poison,
viewers.
huh?
In the same time, we can activate the body viewers too.
We'll teach the body viewer later.
I just want to play some background music or something.
Yeah, to interfere with they can't hear us to begin with.
But the iridology we can.
Okay, calcium 98 now. And let's end with the, what you find, stubborn.
Disappear now. We can say personality unclear or sadness, excess sadness.
I wouldn't give that to me, but okay. It came up a number of times. When you see things that are repeating, that means my unconscious is giving more of a message.
Wood alcohol, where would you pick that? Up
Could be in a lot of places.
in the house or
It's spilled in the food.
spilled in the food?
Okay, close. We've done enough now. We can get out of this page. Don't spend too much time on this page.
You want to do anything here?
No, that detox takes a long time. It's not needed today. Just close the whole page. Done. Done.
What would you like to do next?
Okay, now we want to go to the acupuncture. We're going to do the acupuncture test. Super test. We're going to go through the acupuncture program and have it adjust all my acupuncture points. It's loading up and challenging my body with the energy of the acupuncture points and seeing which ones I react to and which ones I don't react to.
Bladder meridian comes up here.
Oh, it's just a picture. I don't think that's. Okay, sir. Does it show us?
Try and give us a little bit more sound if possible, guys.
Facial pain, glaucoma, belt.
No, our computer says it's on maximum sound.
Okay, then look, super conscious search for points. Let's do this. Okay,
Pick the point right there in the on my back.
pain, yeah.
That's where my back pain is.
And now we just click on it, or
Yeah.
B25, yeah, this bladder meridian.
Test and see.
I just clicked on the image, B25,
That's fine. That'll-
BI25. Do you feel anything?
Yeah.
Tingling?
You still can't hear us?
Jane,
It's very good now, thank you.
Desiree, what do you feel when this point is working on you?
The pain in my back is getting worse.
What, stabbing pain or
It's
burning?
a stabbing pain. That's probably because we're working on it.
99.
Okay, now it feels better. We can't see the bottom of the page. See over here? See that? Right. Yeah, click there.
I don't want to. No.
Oh, you're trying to load that up.
We've lost your sound a little bit.
Come on.
No,
It's over here.
Desi, we can't hear you.
Can't hear me now?
It's very faint.
I just tried that. I don't want to do it. Give it back to me. When we do another treatment, hit the screen.
Rita, it's very faint, eh?
What I'm saying to
That's
that,
better.
if we hit another treatment, I might be able to lift up the screen a little bit better. Because right now, Desiree says that the entire screen page is not visible.
We're not seeing the results of our acupuncture test.
We did not do
Yeah,
it.
that's true. We can't see the whole screen.
Click on that. Consciousness form test.
Now we're doing the acupuncture. Now it'll tell us which points are bad.
Jane, are there any questions or?
Nothing from my side. I think we're all just watching and listening.
Checking hundreds of acupuncture points.
I can even
Seeing if I react to them.
I'm not even hooked up, but I can feel it. It's very powerful.
This is a very powerful therapy. And it doesn't tell us the points that we.
You want to insert physical disorder, your back? Insert. Give me the mouse. We can put in physical and psychological disorders after the 2 lines. Yes, put in your back. Enter concern.
What are you doing, Rita?
Type it in.
I said that we can insert some physical issues like back pain.
You want to invert the issues.
Yeah.
Okay.
And then if you insert psychological disorder, we can put in fear, for example. Because fear came up. Okay, then what? Sadness?
Nah.
Anger? Frustration came up.
Frustration.
Yeah, frustration. Okay, and then we can also enter the code right there. This might be able to give us a lot more detailed scanning and results.
I think it's quite useful for the new people listening in too, is that you can see how a physical out of line situation, for example, calcium, is a manifestation also of Professor Desire Dubonet's frustration. So emotions are played out in the physical.
The machine should be telling me which acupuncture points were not fixed. So I think Laventa hasn't updated this program completely yet. But it has worked on my points, and I've run through it twice. That's usually enough. And now it says bladder. I just did it and changed it from it was bladder 25, now it's bladder 32. This is exactly where my back pain is.
Menstrual issues.
Yeah, I have menstrual issues, I guess. Well, we'll do another treatment of it. My back pain is feeling better now. And now that point has been tonified and fixed. The close button is way down here, barely visible because of our screen. We've done an acupuncture. We'll do a test of the spine here. Trivector energy flow. We're now going to be checking all the different spinal vertebrae. This will take some time.
Desi, I'm just thinking possibly also your posture, because I know you've been sitting for hours recreating all your videos and things. So possibly.
Yeah, I know. Sitting disease, you know. I have to. Sometimes I get so caught up in a project that I don't move enough, and I could sit there for hours because I'm absorbed. And that has really led to a problem. So now I recognize I have to get up and change position every 20 minutes.
Yeah.
I could sit for a bit, I could lay down, and that's why I try to find a way that I could do some of the work laying down, you see, so I don't have to sit all day, and that's what I've been doing.
And what about standing?
Well, standing is, if I stand too much, it's a problem. If I sit too much, it's a problem. Mm-hmm. Because what I have is my spine is getting crushed. I have compression of the spine. So I recognize that I'm going to have to do something about the calcium I see now today. I have to do something more about the calcium. I have to work on trying to, I have an inverting machine to hang upside down. And I have to do other things to try to expand and take the compression out of my spine, to decompress my spine. So those are some of the things I need to do. Okay, there's some long-term injury. And where is it? Okay, we see corrected inflammation in the neck, nerve compression, not corrected, difficult, nerve compression. And this is where I have my big problem, in the lumbar. So I can give it another treat. We'll go through it again, see if it can fix those things.
There's also some of those Asian squatting and rotation of the pelvis to get it.
I've been studying every bit of yoga and everything.
Studied it all.
Yeah, oh yeah. That's a big presentation. Let's just leave it at the fact that I'm doing it. I'm leaving no stone unturned.
Good.
And we can see now. Boy, this is going off. Oh, give me this.
That's okay now.
Okay. sleeping position. That's why I realized I'm going to have to develop a different sleeping position. I've been sleeping on my side, but not the way I really need.
If it says not corrected, then you can just.
After the second time, you can go to these, but you see, it's not always working. I see the nerve compression at the bottom there.
Yeah.
Go up, right there in that column. The bottom. Yeah, right there. That's where I have bad nerve compression. So I have a lot of work to do on the spine. We could continue this now, but well, let's just play with this a little bit more. Let's run the test and see. No, yeah, run that one more time. Let's run this one more time. See if we can fix some of these. My spine starts to feel a little better now. Good.
But I think that also the water aerobics you're doing and the weight compression with your neck helps a lot.
Yeah, but I got a problem with this calcium.
Somebody is interested, you can explain what to do in the water to put the weight away, like decompress the gravitation.
Let's talk about that later. That's what I had a question about it. They're trying to learn the machine today.
Yeah, I just mentioned it because many people have spinal issues and neck problems and back.
So what I've learned today is that the machine has picked up on my back problem. It's picked up on the cat allergy. I haven't done anything to relieve the cat allergy. That's the allergy profile. We'll do a whole lecture on that. Right now, we're kind of working on the back more today. And I went through the acupuncture point to stabilize all the acupuncture meridians. Now we're working on the spine. I've learned that there's a problem regarding my calcium. So I'm going to have to take some calcium. I haven't taken any calcium for a while because it leads to premature aging, but I'm going to have to do something.
What do you think the cause of the calcium loss is?
Well, the machine's telling me some type of a poison. So I'm going to have to study that a little bit more. So
detoxify.
From the up here at the top, that the cervical thoracic, a lot of things have been corrected now today. There's still a couple ones that are not. Okay, so we still have some problems to work on. Give me the mouse.
You want to go do NLP or?
Now we go to NLP because we're running on an hour with the patient. When we get to an hour with the patient, we have to pause now and say, because we need to budget our time so that, because what I've done now is I've done good service for this patient for an hour, and would say that I'm billing $100, $125, $150 an hour. If they want a second hour, they should pay for that. So I would stop now and say, do you want me to continue? If I have another patient scheduled, I have to say, no, I'm sorry. Well, I have a couple of minutes left. Let's debrief and let me summarize what we've done. We always want to debrief the patient. What did we do? What do we recommend? What do we recommend that we always want to talk about them doing more exercise or less exercise. We always want to address their diet. We always want to address stress reduction. We always want to address stretching and yoga and meditation. We want to talk, because if you want something different, you got to change. So what is it that the patient now needs to change? So we want to do that in a debriefing. But if they want to spend more time doing more work, well, then they should make an obligation to either pay more. And if they can't pay it in cash, then maybe they want to pay it in karma. But it gets to a point where we're going to get down here and we're going to be able to work on a neurolinguistic program, something in a longer program, where we can go to the NLP. We make an unconscious choice. Clicking on that button, we go up here. Lyme's-like disease. Well, my unconscious has picked that, so we should do it a favor and at least rectify it. Bring the thing up. And start. There we go. Start. It'll take a couple of minutes to rectify. My unconscious was probably chose that for some reason. I never would have thought of that. But I did get bit by a tick over the summer. So maybe that's part of it. So now, if I'm going to continue, I'm going to do more work on relaxation. I'm going to be talking to the patient about change, etc. Or I'm going to be turning them on to some of the new video programs and letting them do a 15, 20-minute deep electroceutical treatment. So, and then what electroceuticals they might want to take home and use. So that's what I'm going to be doing in the debriefing.
And then I always do at the end chakra balance, maybe aura balance and cleansing. And if somebody still needs some help, then I go at the end to psychic disturbance, psychic protection, and anti-aging sometimes, and beauty programs at the end. And
Rita always goes to 2 hours, but she usually bills for an hour. But if you're going to do that, then at least discuss karma pay. Say, listen, the fee that I have for an hour is this, 150.
I am a lot better now than I was at the beginning.
Yeah, I know.
At the beginning, I would do 4 hours and 3.
Yeah, she'd have them do a machine sleepover.
Yeah, most of the patients were asleep after an hour and a half or 2.
And sometimes you're just doing too much. If you're getting alarm responses, you're going too fast. You're doing too much. You see the rectification down there at the lower is now 70 rectification. We want to do at least we would wait till the 100. We can do more.
And this is something what you can also, this is something what you can also leave on subspace. And even if you're not sitting in front of the screen, for example, your child goes to an exam, you can leave the program on super learning or focus, staying in the zone for a sport competition, school exam. The NLP programs are all designed to also run subspace. They are very powerful. And also the time therapies, the biofeedback systemic relaxation programs as well.
Lots of other programs you can go into, past lives, all different types of things. I've given you a really big Swiss Army knife here. And we'll be doing lectures about each and every one of those over the course of the next year so that you learn all of those different things. We'll get them into an archive. But right now, this is the basic stuff that you just need to know now. How to turn it on, how to turn it off.
How to get started with the risk profile and the matrix.
And after we hit 100 here, I'm going to go back to the test screen and search on the calcium.
It is also very necessary and useful to work on emotions, where you can add hormones, love, emotions. You can check the unconscious choices with fear, frustration, greed, whatever.
All of these things you start to learn to listen to your gut. But right now, we're just giving you the basic.
And tomorrow, if you follow us, in the afternoon, we are going to give a 2-hour introduction of this program with QX World.
We'll be hitting these buttons again tomorrow.
Yeah, just a little bit longer. It will be an online free congress. Everybody
Super, thanks.
Join. Everybody is welcome to join. But I believe after a while, who works with the device, you will build a consciousness with the device, and the device will just simply lead you from program to program to
The device
panel to panel.
well, the device interfaces with the patient's unconscious.
And with the
The
therapist.
patient's unconscious is making the choice, not the device.
Exactly, but the device, if you have your device, and then your device will guide you what is the best for the patient.
The patient's
Yeah.
unconscious expresses itself through the device.
Yeah, and then if you are in harmony with your device, then you will know exactly where to go with the device.
The radio is not playing the music. It's played by somebody else. It's just transmitting it. So you see here, we got 100 now. We're going to stop this autofocus therapy. And I could do more autofocus therapies, superpowers, all these
Mental
different things.
factors, emotion chart, where you can add the hormones and the emotions, and you can zap them, and then also use them in the newest GSR CDCS program.
If I go back to this program,
and always do the rectification when you close down a session at the end to full rectify the patient. We will show you exactly where to do that.
click the tab. No, click the space bar. Just going to check calcium. Connected to allergies.
Do individual reaction.
Okay.
Check for causal. Here you can see what is causing something, what is the cure, what is etheric with it. You can always check it down below in the left.
What is the cause of my
allergy?
No.
Calcium.
Let's just take out the sorbate. It's space bar again. One more. Yeah, there we go. Take calcium right out imbalance. What's the cause? The machine is now remembering everything we've done. The longer we've worked on it, everything that is done, checking things out.
Iron aspirate, highly absorbable nutritional form.
It's potassium. I need potassium. I need calcium
Okay,
lactate.
which shows here the cause? The purple or the red?
We'll see the high numbers.
High numbers.
I need potassium. I need calcium.
Spiritual
Witch hazel. Rose quartz.
Love stone.
Muscle.
You have
to work the muscles.
You have to forgive and let go of your anger.
Hello.
Pride.
These are the things connected.
Digest.
To my problem.
Enzymes.
And the causal. What are the mental echoes?
No. I know the joke.
I think so.
Rita and cat. Parasite, tapeworm came up.
Tapeworm.
That can be from the dog.
Circulation, lipid, memory, tartine,
liver.
Food additive. Might be snuck into our food. Here's another roundworm. I think it's time for me to do a worm detox.
Yeah, that's colon rash.
Yeah, we better get some of that worm detox.
Vermex.
What's the curative echo?
Turn off the computer. You have to all know that Desiree works too much. She sits in front of the computer sometimes for 8 and 10 hours.
Now, dandelion is a very powerful herb that will take poisons out of the body.
And you said that 2 days ago that we should collect that. You remember?
Yeah, I know.
Prostate.
Artisama.
Pollen. Yeah, we have some new plants growing in our garden that can be pollen.
So you see,
you never did you drink an energy drink or
what?
I don't know. Taurine is in energy drinks usually, or
Yeah, oh yeah, look, taurine.
mm.
So you see, this will start giving me pollen in my lungs, allergy.
Oh, you had that shrimp, what was not good anymore. The parasites can come from that, maybe.
It's possible.
Yeah.
So you see, these buttons here help to direct me to, but if you do these buttons at the beginning, the machine doesn't have enough to work on. This is something you do after you've been hitting buttons and doing things.
And you can also involve the disease dictionary, because that's a
And
little
you
bit.
see these things coming up here. So I need to detoxify the bowel and liver,
You want to show the disease dictionary? That's all.
protozoa, respiratory disease, memory,
Disease dictionary.
different lectures. So these are little tips, and these buttons down here are there to, at the end, when you at the end session, you could start to get some hints, to start to get a picture of what's going on. It can't really tell you exactly. It can only pick items. Then you have to kind of pull the threads together to make the tapestry.
Yeah, you have
Okay.
to have some awareness and some knowledge to actually translate the information what
Right.
comes up in the matrix.
Okay, so I think we've covered a little bit here for you today.
And then do the rectification close. Next week, if we get the opportunity, I would like to do more spiritual stuff like environment cleansing, aura, chakra balance, color therapy, psychic disturbances, and more emotional and hormonal for super learning enhancement. Sometimes what we do is we try to separate the sessions, like if the patient comes once, we do overall physical body and health restoring, and then the other time we try to do spiritual healing, sport, super learning, because sometimes it would be too long, and then the body electric gets overcharged. So after that, it is not worthwhile to do more and more. It is better to share the time and get it like a separate way.
I clicked on the short rectification button to try to rectify. And this is a button that's at the end that's designed to kind of, try to rectify all the little different energy things that haven't been rectified. And the rectification is at 101.
Excellent.
The overall system still is only at 47, so I got more work to do.
And here in the front, if you don't want to go to the hormone streaming and sport program, we have the shaping function where you can
I'm
actually.
not sure about the shaping function.
Yeah, shaping function enables us to do short treatments and.
The shaping function works as a
Yeah, but it is.
So
like,
I'll talk about
it
that.
It is a shorter version than the sport program, and it is a little bit easier to access.
Okay. So I've given you some ideas today, eh?
Yeah, you absolutely have. Thank you so much. Unbelievable. And, it never fails to amaze me that I don't think any of us will really know every single nook and cranny and corner of the software. It's just, you learn more.
Over the course of the next year, I hope to teach every little.
It will be amazing. And thanks a million. I'm sure people who joined in today really, really enjoyed it. And Daisy, I've just put in, I think people need to just go and Google the QX World Online Congress 2021. If you just go and Google that, you'll get the link to join tomorrow night. And I just think live lectures like this is just amazing because it's the way we're going to learn. Live case studies is how we're going to really, really grasp everything and the vastness of the OMNIS software.